COVID-19 restrictions are back in place after 6 weeks of efforts to transition into a new normal. For more on the tasks ahead amid the resurgence, I have Professor David Kwak from Sooncheng University. Welcome back, Professor Kwak.
Good afternoon, Sunny.
I also have Dr. Kim Seung-taek at Institute Pasteur Korea joining this session virtually. Dr. Kim, it's good to see you again.
Good afternoon.
Professor Kwak, that is. I'll start here in the studio. A fresh set of COVID-19 prevention measures went into effect this past Saturday, with authorities highlighting the severity of the latest situation. What is your assessment of Korea's COVID-19 situation?
Well, I think the fact that they started on the weekend instead of the usual Monday to start off the new measurement reflects the severity and the direness of the situation that we're going through. As it was already mentioned during the reports, that we're facing about 1,000 or more cases of severe patients, and also we're seeing daily death rates of more than 50 every day. And it's on top of almost daily confirmation cases hitting up to 7,000 or more daily as well. So the government probably take into consideration the situation, especially that regarding the severe patients, and also those patients who are still waiting in line to be admitted to hospital is quite worrisome. So I think the measurement was taken quite in a very urgent manner to take care of that. The situation, I believe, as I probably mentioned this before, but I think I'm still staying hopeful because I was expecting for the numbers to hit rather a plateau coming into this week and hopefully next week, because and also the reason that I mentioned before, there is a factor called scare effect, that the people once starts to notice that there are such many cases of daily confirmation cases as well as the mortality rate, people become more reluctant to actually come outside and mingle and come into physical contact to expose them to the possibilities of infection. So in whichever way, I think all the factors are coming into place to take an effect in the daily case toll numbers, as well as the measures that the government will start to take place. So I'm hoping all of those factors will come into place to mitigate the further increase in the numbers.
Right, hopefully. Mm-hmm. Dr. Kim, these new restrictions, that is, are in place for roughly 2 weeks, reportedly to secure enough time to boost medical capacity and vaccine-induced public protection. What are your prospects after the 2-week period?
Well, I believe the 2 weeks probably is not just enough, just long enough. And then first of all, in this case, we have to actually distinguish two different categories. The first one is the number of total COVID-19 cases, and the second one is the number of severe COVID-19. But I think that for the first part, within the this 2 weeks period, maybe we can just slow down the further spreading of the viruses, and especially compared to the control measures. I think the control measures will somehow effect. And then for the severe COVID-19, the COVID-19 disease is like there's certain disease course. So once a person is actually infected by this is SARS-CoV-2, then the person is first of all is experiences some mild disease. Then depending on the some risk factors, that some person actually progress into the severe COVID-19. So within this 2 weeks of period, I think we would not see any sudden decrease in the number of severe COVID-19 cases, because those the severe cases, the already infected person would somehow, depending on their risk factors, might progress into the severe COVID-19. For in that case, we might see some effect of this some control measures, maybe even after this some social restriction at this moment.
So do you believe these restrictions should be in place for a longer time period then, instead of 2 weeks, maybe 4 weeks?
I think so, because actually the government will monitor the some status of all the total number of COVID-19, also a number of severe COVID-19 patients, and then maybe 10 days or a week later, the people will get together and then assess the some current condition, and then we'll decide whether to extend or not.
Right. And Professor Kwak, what is your forecast of the COVID-19 situation here in the local front in light of the current guidelines?
Well, I absolutely agree with what Dr. Kim has just mentioned. Usually when a certain strict measure takes place, it takes about a week or two for the effects to actually show up in the real world. And since we started just over the past weekend, these stricter social distancing guidelines, I think it's going to really come into vision a week or two later. But as I mentioned, what's more urgent is the situation at hospitals. People are still waiting in line. People are still dying, even at homes. And also, as it's been reported numerous times, the ICU beds are completely filled with no more buffering capacity anymore. I believe the government is also taking measures to overcome those obstacles, such as in mandating certain hospitals to expand their bed units and whatnot. But at the time being, the stopping of the social gathering does not necessarily mean an instant decrease in the numbers or instant decrease in the ICU bed fill-ups. So we would have to see a couple more weeks to see how much of a benefit we would gain from this measurement taking, and also reassess the whole situation right afterwards.
Right. Meanwhile, elsewhere, the UK recorded over 92,000 new infections on Friday, and authorities there are working around the clock to contain the latest resurgence driven by Omicron. Now, for more, I have David Cox live on the line. David, it's a pleasure to have you back.
Sunny, thanks for having me on the show.
Right, let's begin then with a few words on the current COVID-19 situation there, David.
So the landscape has unfortunately changed quite a lot in the last few weeks. So as you say, the number of daily cases has just really spiraled in the past week. And Boris Johnson is basically trying to tackle this by basically getting as much of the population to receive a booster vaccine by the end of December as possible. The key thing here at the moment is that while we know that Omicron is very much more infectious than anything which has come before with COVID-19, we don't know whether it's more severe. So we're still waiting to see whether the number of hospitalizations and deaths will also go up in the coming weeks. So it's still a little bit of a matter of wait and see right now.
Right. Meanwhile, in response, though, on Saturday, David, I believe London Mayor Sadiq Khan declared a major incident in the city. What does this declaration mean?
So the big thing is that the SAGE group, which is the group of scientists who advise the government, they have suggested that without current interventions, so without more restrictions, the hospital admissions could reach 3,000 a day in January, which has concerned a lot of people. But this is the worst case scenario. So at the moment, we're still not seeing hospitalizations going up significantly. But if that does happen, as some scientists have forecast in the next month, then we could see much more severe restrictions and potentially another lockdown.
I see. Meanwhile, Dr. Kim, given global concerns over Omicron, there appears to be growing interest in the potential impact of COVID-19 pills on the battle against the pandemic. What are your thoughts on this?
Well, there are just two drugs that are actually being just discussed right now. The first one is a Merck drug, and then the second one is a Pfizer drug. And unfortunately, the Merck drug, based on their interim analysis of phase 3 clinical trials, they show the 50% of efficacy of just inhibiting progression into the severe COVID-19, and then there was no death. But actually, based on their final report of the phase 3 clinical trials, the final efficacy was actually recorded as 30%, which is a little bit just disappointing. And in the case of the Pfizer drug, the Pfizer drug has actually completed the phase 3 clinical trials. And then even after phase 3 the end of the phase 3 clinical trial, they still just showed 89% of efficacy, which is actually inhibiting just the progression into the severe COVID-19. So just in terms of preventing the severe COVID-19, the Pfizer drug seems to be very effective. And then regarding the Omicron variant, not all, but most of the mutations found in the Omicron is actually identified in the spike protein. And the spike protein, this is actually the main target of most of the vaccine development and the monoclonal antibodies. So maybe vaccine efficacy and then monoclonal antibody efficacy might be substantially just affected by these mutations found in the Omicron. And then we are actually observing some of the very negative effect on the monoclonal antibodies and the vaccines already. But in the case of this Merck drug and the Pfizer drug, the antiviral mechanism of action is very different from those of monoclonal antibodies. Monoclonal antibodies is actually targeting the spike protein, but the Merck drug actually just targeting sort of just RNA-dependent RNA polymerase, which is actually involved in the viral genome replication. And then the Pfizer drug is actually just targeting some viral protease, which is actually involved in the some processing of a viral polyprotein. So basically, it's just targeting just the protein of these two oral antiviral drugs is quite different from the other just medications so far. And then theoretically, the Omicron would not be just the effect at all for those the antiviral efficacy of those two antiviral drugs. And then in part, the Pfizer actually announced that their drug, the Paxlovid, is not affected by the mutations found in the Omicron, at least based on the some their cell culture experiments. And I think that there is no just probably there is no substantial effect on the antiviral efficacy of these two oral drugs by the mutations found in the Omicron.
Right. And staying with COVID-19 treatment pills, David, last month the UK became the first country to approve molnupiravir. And I hear there is a study being led by Oxford University on its efficacy as we speak. Could you tell us a bit more about this study?
So the whole idea behind it is basically to see whether this drug can prevent more vulnerable patients, so like the over 50s and patients of underlying health conditions needing hospital treatment. So this drug, the idea behind it is that there has been data which shows that it can reduce the likelihood of being admitted to hospital with COVID-19 by 90%. So this clinical trial wants to see whether that truly is the case, because there has been some other data which shows that it could be a little bit lower. But the whole thing is that scientists are saying that even if it just reduces the severity of COVID in those vulnerable populations by a little bit, that would still be a very valuable benefit. But that whole idea of the trial is just to see just how effective it is.
Right. David, the UK Health Minister Sajid Javid has left open the possibility of a circuit breaker, even ahead of Christmas, which would be this Saturday. What are the prospects of such a scenario, and how do you expect the public will respond to a circuit breaker?
Well, I think most people in the UK are opposed to the most severe restrictions, so a full lockdown. But I think people would support more like smaller measures. So, for example, reintroducing social distancing in hospitality venues. I think we have to see what will happen. It's really hard to predict. But the Prime Minister, Boris Johnson, has repeatedly said he is opposed to a full lockdown. And I think there's like a lot of members of Parliament who also are like on the case. I think what is more likely to happen in the coming days is that we will see some moderate restrictions reintroduced. So perhaps like limiting the amount of households who can mix at Christmas. But I don't think we're going to see anything as drastic as a full lockdown, maybe until the new year, perhaps.
David, current restrictions in place do include a mask mandate, right? Could you tell us a bit about that?
Yes, so at the moment we have to wear face masks in all indoor venues. There's also COVID vaccine passes. And over the past week, people have been told to work from home again. So these are some restrictions which we haven't had in the UK since, May, June time. So it has been quite a game changer for people, the rise of Omicron. It just remains to be seen whether we're going to have even more restrictions to come.
All right, David, as always, thank you very much for your time and your thoughts at this hour.
Thank you.
Right then, Professor Kwok, of administrative orders, that is, for more beds for COVID-19 patients have yet to be fully implemented here on the local front. What appears to be challenging these efforts?
Well, it's really more about the feasibility issue. Even if there was an administrative issue, the medical sector really has to physically come up with those beds themselves to really increase or expand the capacity that the government is, I can't say demanding, but requesting. What that means is for these hospitals to actually allocate these certain units of bed to only care for the COVID-19 patients instead of the ordinary patients that used to take care for those patients who would have been treated now has to either distribute it to other hospitals or to be delayed in their procedures and treatments. So But considering the situation, the direness of it, I do agree partially with the government's decision to even request the administrative orders for these hospitals to sort of expand their capacity towards treating COVID-19 patients. But it always comes with a certain price, as I mentioned, so that has to be also calculated. And also physically, some of the hospitals just plainly cannot come up with those units even if they wanted to. Because that would also mean the patients will start to, well, either get sick or be delayed in their treatment. That could cause a secondary and tertiary effects from it. So I think the government also has to come up with an additional alternative method instead of just ordering the hospitals to come up with bed units, but instead maybe, I believe there's a congresswoman currently stating these statements that I'm about to make, but she requested that the government considers those hospitals currently closing down due to financial issues, maybe utilize them to further expand the capacity that we currently need. But a bunch of other alternatives, I'm pretty sure there are plenty of smart people that can suggest very good ideas. We should definitely take a listen to them as well.
Professor Kwok, if we did have enough hospital beds, though, do we have enough people, healthcare workers, to attend to COVID-19 patients if there were more beds?
That's actually a very critical issue and a very good question. As previously we've talked about this, that's also a huge issue. Even if we come up with more bed units, we also still need medical people, including that of doctors and nurses, who should be able to take care for COVID-19 patients. But this, on top of these physical spaces that we could come up with, allocating those people to only COVID-19 patients, which will mean that those people will no longer be able to be used for treatments of other diseases. Obviously, that'll cause secondary, tertiary effects. So as I said, we would have to come up with additional alternative methods as well.
Right. Dr. Kim, health authorities have called for restricting the length of intensive COVID-19 treatment to 20 days to allow for treatment opportunities for other COVID-19 patients. What are your thoughts on the logic behind this call by the government?
Well, there were actually just a couple of scientific reports on the how long the COVID-19 patients actually shed infectious viruses, and for the some mild COVID-19 and also for some severe COVID-19 patient. And that's why we actually now just choosing the 10-day for mild COVID-19 or some asymptomatic just COVID-19 patient after just identifying whether they are positive or not. And then for the severe COVID-19, this 20 days of isolation in the some ICU bed is also just a guideline of the US CDC. And those kind of just numbers actually based on the some several just scientific the discoveries. But some the clinicians and the scientists actually are just worried about this decision because the situation is actually a little bit different in between just the US and Korea. In the case of US, most of the severe the patients actually just occupied one room is actually one single room is occupied by just one patient. But in the case of Korea, actually many just the people share the same room. So the concern is that even after their just isolation within the specific ICU bed is now just released, their chance of just shedding the virus is just probably lower. But then, which means this does not mean that there's no virus whatsoever. There's no just 100% anyway. So in our just Korean situation, even after just releasing from any special ICU, just the bed unit, then the people just share the same room with the other non-COVID-19 just patient with the severe just morbidities. In this case, the chances are maybe that the released patient can still just transmit any some residual viruses to other non-COVID-19 just COVID-19 patients. That's so kind of just a concern at this moment. So I think many just clinicians are actually concerned about that, and then we might be just come up with some better just alternatives or just a solution to just somehow compromise such kind of issues.
Right. Meanwhile, Professor Kwok, what more do you suppose can be done to encourage public vaccine uptake?
Well, so we have to talk about incentives and whether or not we should take the restrictions we're currently taking, especially implementing the vaccine passes. Well, as I've mentioned several times before, I'm a person who's completely against the idea of mandating such passes. I think we should come up with better ideas to really give even more beneficial incentives to the people who received vaccines, and also still further expand the ideas of better education and better information. What I personally think about the situation, though, is that, as Dr. Kim mentions, we are quite unique, different from many of the Western countries, let alone the US, in the sense that we are isolating everybody who is confirmed, whether that be at home or whether that be at social facilities. Once we start to have an access to these oral pills, irrelevant of their efficacy, just because they are so much accessible by the people going through much more mildly, or even those at home, or those are stationed at isolation facilities, because they could just get a hold of it, I think it'll benefit us way much more than any of the other countries. So I think maybe in the footsteps of what the UK is currently taking, we could also really form a committee to make the decision on the emergency use authorization, putting that on the oral pills that are currently being studied. Possibly if we can bring that in the near future, I think that's going to make a huge and drastic change to the picture we're currently seeing, just because it's so much more easily accessible.
I see. One very quick question. This is an impromptu question, Dr. Kwok. There are concerns over in the UK, though, that the presence of a COVID-19 pill like molnupiravir could actually promote, that is, or lead to more mutations within the virus itself. Could you explain this for us? Very briefly.
Well, yeah, at least there was some papers reporting some kind of mutagenesis effect by the molnupiravir, and that's because of their underlying mechanism of action. But according to Merck, based on there are some comprehensive animal experiments, they did not see any genotoxicity issues in the animal experiments. And then they also said without such animal experiments, then they would not even pursue the phase 1 clinical trials with this molnupiravir. But we need to take some very careful, because that's why the government the regulation officers actually there is some restriction on the use for some pregnant women and then some very vulnerable people.
I see. All right, Dr. Kim, as always, thank you very much for your insight. Professor Kwok, as always, thank you very much for your time and your thoughts.
Thank you.